skin. I'm going to be your student nurse practitioner, and I'm going to be doing an assessment on you. First, I'm going to wash my hands. Sir, can you tell me your name?
My name is Chan Jones.
How you doing, Chan? How are you feeling today, sir?
All doing fine.
Excellent. Can you tell me why you're here?
Here for a checkup.
Excellent, sir. So like I said, my name's Ken. I'll be doing performing an examination on you today, and this should be very quick and very painless, okay? Wash my hands. Here I'm looking at Mr. Jones. He appears to be well developed, healthy young male, and he appears to be dressed appropriately for the season. First, sir, I'm going to go ahead and approach you. I'm going to touch your skin right quick. I'm looking at Mr. Jones's skin, and I noticed that his skin appears to be pink. It is warm, and it is dry to the touch. I'm going to look at his head. It appears to be symmetrical. There appears to be no lesions, and there appears to be no wounds of any kind. Do you have any pain in your head, sir? Excellent. I noticed he has good distribution of hair. I mean, rather short. Of course, he's in the Marine Corps, and that's what happens. So I'm going to touch his hair, touch his head. I notice no bumps. I see no bruises, no lesions. Coming down to the face, looking, and can you grit your teeth for me? Feeling for the 5th cranial nerve, the mastoid. It looks like he has, does it hurt when you do that? Excellent. So what I want you to do is raise your eyebrows for me. All right. Can you smile? Excellent. That looks symmetrical. And can you puff out your cheeks for me? Excellent. So cranial nerve 7 looks like it's good. So we're moving down to the eyes right now. It looks like his pupils looking at about 3 each, and they're each equal. There's no anoscoria present. Notice no jaundice, and it looks like he has good pink conjunctiva. So what I want you to do right now is just look at me, and we'll look at my fingers, and I want you to just follow with your eyes. Excellent, excellent. All right, 3, 4, and 6. Looks like he does well. All right. Got my ophthalmoscope here. Just look at my nose for me. Excellent. Look at my nose for me. Excellent. Equal, reactive, and accommodating. I'm going to touch your face again. What I want you to do is just look up for me. All right. The conjunctiva are pink. I notice no jaundice. Look down for me. No jaundice notice on the sclera. I'm going to look at his nose. Nose looks patent. I'm going to touch your face one more time, okay? Do you have any pain over your sinuses, sir?
A little stuffiness in there, right under your thumbs.
All right. Excellent. All right. What we're going to do is move to the ears now. I'm looking at the ears, and I'm noticing no drainage. I'm going to go ahead and get my otoscope out. Using an up and back technique, looking in the left ear, and looks like the cone of light is present. All right, up and back, looks like we're present there. No swelling noted. Back over here. Everybody can see me. I'm going to go ahead and touch I'm going to feel your preauricular, your postauricular, your tonsillar, your occipital, submandibular, submental, the superficial cervical, posterior cervical, and the supraclavicular lymph nodes. They all appear to be mobile and non-inflamed. I'm going to go ahead and put on some gloves. gonna look in Mr. Jones's mouth now. You just go ahead and open your mouth. All right. The uvula appears to be midline. The mucous membranes are pink. They are moist. The tongue is not coated. It looks like there is no gum bleeding, and the gums are pink, and all his teeth are present. I'm going to go ahead and open your mouth, stick out your tongue. All right. Say ah. All right. Notice good rise in the back of the throat. The 12th cranial nerve is intact. All right, we're coming down to the neck at this point in time. I'm going to touch his thyroid, and I'm appreciating it is flat. There are no borders present. Do you have any pain with that, sir? Excellent. Can you sit up for me for a second? Excellent. Can you go ahead and bend your neck forward? All right, bend your neck, flex it back. All right, can you move it side to side? Any pain with that, sir? And no step off to the neck noted. All right, we're going to go ahead and lay the patient back again. I'm going to go ahead and listen to the patient's carotids. Touch your neck one more time. All right. Both carotids are present. There is no thrill or bruise noted in the carotid. I'm going to then come down to the chest. I'm looking for any, I'm also looking for the hair distribution. The patient would normally be stripped, but I'm looking for any deviation in hair distribution, any nevi, any lesions or wounds. There is no trauma to the patient at this time. I'm looking for equal excursion. I'm also looking for 2 to 1 AP diameter, and this gentleman does have that, as he has no pulmonic disease. I'm going to go ahead and listen to the heart sounds. I'm going to listen to the atrial, the aortic valve at the second intercostal space at the right sternal border. I'm using my diaphragm at this point. I'm listening to the pulmonic at the second intercostal space on the left sternal border. I'm listening to the Erb's point at the third intercostal space on the left sternal border. I'm listening to the tricuspid at the fourth intercostal space at the left sternal border. And then I'm going to listen to the mitral valve at the fifth intercostal space at the left mid-clavicular line. And then I'm going to find the point of maximal impact between the fifth and sixth intercostal space. And I'm going to listen to that for about 60 seconds to check for rate, regularity, and any irregularities. And I noticed that the rate is regular and the rhythm is regular. Nice and slow too. All right, now I'm going to repeat this by going over the bell, and what I'm listening for now is any murmurs or any adventitious sounds in the heart. And I'm just retracing over the points where I used the diaphragm. All right, listening to the heart sounds, good S1 and good S2, no S3 or S4 sounds, no other adventitious sounds or bruise heard at this point in time. Now we're going to listen to the for any adventitious sounds in the breath sounds. Sir, when I ask you to, what I want you to do is take a breath in and out. Go ahead. Excellent. Good excursion. Go ahead. Excellent. Again. Excellent. More percuss. No dull sounds. Sir, if I could, I'm going to have you sit up for me. What I want you to do, if you could, go ahead and take a deep breath. All right. What I'm feeling for right there is equal expansion, and he does have equal expansion, and I noticed that there is no tactile fremitus noted. I'm going to listen. I'm going to listen. Take a deep breath, in and out. Deep breath. Excellent. Deep breath. Deep breath. Could you say E for me?
E.
You say E for me?
E.
Say E for me?
E.
Say E for me?
E.
All right. I'm going to percuss your chest real quick. Percussing in 6 spots. Excellent. We'll have you lay back again, sir. Excellent. All right. No adventitious sounds heard. No egophony or bronchophony noted. Now I'm moving down to the patient's abdomen. Looking for the abdomen. I'm looking for any wounds, any like hernias, any abnormalities, any lesions. I'm looking for any nevi and good hair distribution. This gentleman is obviously good health, so I see none of that present. I'm going to go ahead and first inspect the abdomen. I noticed no pulsatile masses. I know no nevi. I'm going to go ahead and first listen for any aortic bruits. I hear none. Now I'm going to listen to the 4 quadrants of the abdomen. Good bowel sounds heard throughout. And what I'm going to do is I'm going to touch your belly, sir. You might feel a light pressure. I want you to let me know if you feel any pain, okay? Starting at the left lower quadrant and moving up to the transverse colon, coming down to the sigmoid colon. I notice no pain. I'm going to go ahead and percuss over the urinary bladder. See if it elicits any pain. You feel any pain? All right, well, I'm going to have you lean forward. Is I'm going to go ahead and percuss the costrovertebral angle as well to check for the kidneys. Any pain, sir? Mm-hmm. Excellent. Go ahead and have a lay back. All right. We're moving down to the pelvis now. I'm looking for any obvious asymmetry. The legs appear to be equal. There's no lateral or medial rotation noted to that. I'm going to go ahead and go ahead and get the pelvis and see if they'll have any pelvic stability. I notice he has no edema, no abnormalities. Do you have any pain when I touch your pelvic girdle? Excellent. So touching feeling for any pain or discomfort when I touch his thighs and also his calves. Checking for patellar stability. What I'm going to do is bend your leg up like that. Does it hurt when I do that for you? All right. Also do a drawer test for the ACL. Does that hurt when I do that, sir? Okay. Moving around, doing that to the other side. Does that hurt when I do that, sir? All right. Push down for me, sir. Excellent. Pull back. Excellent. What I'm feeling for is the posterior tibial. And I'm also going to feel for the dorsalis pedis. Checking for Babinski reflex. Coming up to the upper extremities. I'm going to feel for elbow flexion and extension. I'm going to touch the, I want to check the brachial versus the radial pulse, which appears to be intact. I want to come over here and check the other one. Checking the brachial reflexes. Good. All right, sir, if you could come to the edge of the bed for me. Hang your feet over here. Excellent. All right, what I'm checking for right now is any edema. I'm checking for mobility of the ankles. Do you have any pain or discomfort when I do that? Excellent. All right, what we're going to do now is I want to check your strength. Pull down. Excellent. Hold your arms up for me. Close your eyes. All right. Excellent. Good job. What I want you to do now is stand up. And what I want you to do is to the door. I want you to just heel toe, walk with heel toe. Excellent, excellent. All right, turn around. Heel toe. All right, got excellent stability. All right, go ahead and have a seat. Sir, do you have any questions now that I've completed my assessment? This time I'm gonna wash my hands. And this is complete.